Bismillahirrahmanirrahim. Assalamualaikum. I'm Natasha and here I brought to you the story of cholera. Generally, cholera is an acute diarrheal illness that infects our digestive system, specifically intestine. This disease is caused by a bacteria. We call it as Vibrio cholerae. I guess many of us didn't familiar with this disease since there is low percentage happen in our country. But little did you know that this disease even bring a pandemic in certain country. Yep, I'm talking about the pandemic of cholera disease in India. So how this cholera disease causes a pandemic in India? So I searched around the internet and found a few articles. It is said that Vibrio cholerae, the bacterium that causes the cholera, is usually found in food or water contaminated by a feces of a person with the infection. So I can speculate the most trigger factor that happened in India is because of, first, the hygiene, where improper hygiene will lead to the contamination of Vibrio cholerae. The second one is the food, where we know the people in India is low in economy, so they ingest food and water that contaminate with Vibrio cholerae or Cholerae bacteria. So guys, how Vibrio cholerae transmit through our body? So in order to know about this disease, we have to know first about Vibrio cholerae biologically. Okay, Vibrio cholerae is a gram-negative bacteria, which literally a bacteria that bring infection to a host, and some of them resistant to any kind of drug, for example, antibiotics. Vibrio cholerae is an organism that able to make ATP by aerobic respiration, which literally when the presence of oxygens, and also capable of switching to fermentations when there is no oxygen around. This action we call it as facultative anaerobe. This Vibrio cholerae also live in a brackish or saltwater environment where it attached to a chitin containing shell, for example like crab, shrimp and other shellfish. In physical terms or in physical appearance of Vibrio cholerae, as you can see at the top of the slide, it is a comb-shaped bacteria, also has flagellum at one cell pole as well as a pili. This bacteria is a halophilic, where it can survive in an extreme condition. In this case, is in terms of high concentration of salt. So for transmission of the bacteria, I have divided into three simple ways for our understanding. The first one is attachment of intestine. In order to go to the intestine, the cholera the bacteria must enter our stomach and also our immunity system. So how these bacteria survive all of that? This is because the Vibrio cholerae has the outer membrane vesicle, which literally act as protective shield to protect them from all kind of immunity system and also acidic environment. That's why it can enter our intestines successively. So after they enter the intestine, they will go to the next stage, which is the release of toxins. These toxins we can call it as toxin coagulated pilus or cholera toxin. This is where it will create the environment in the intestine where the outer membrane or the outer side of the cell is hypertonic to the inner side of the cell, which literally force out the water inside the cell into the intestinal tract. This environment or this action will create a symptom to the host or to the patient, which is we can say a watery diarrhea. When the watery diarrhea keep occur or continuously happen to the host, there will become dehydration. That is why the people in India will keep vomiting and also having watery feces, which literally if this occur or if it worsen, they will lead to a death of a person. So, as a Malaysian, there is a way to prevent this disease from getting to us. The first one is the water. Please drink safe water that are boiled and also chlorinated first. And the second one, the food. Wash your fruits and vegetables properly with safe water every day before eating. The third one, the hands. Wash your hands with soap and water after use the toilet or before handling the food. And the fourth one, and the most important, is cooking. When you cook, you should cook the food properly in high temperature so the food are not undercooked, which literally some of the bacteria can survive it. So that's all from me. Thank you. Stay safe. Take care.